my name's Christina and this is my subcutaneous injection video. First thing I would do is verify the physician's orders. I would then want to verify the 6 rights of medication administration: right patient, right time, right route, right dose, right medication, right documentation. I would then check the medication order in the EHR. I then want to calculate the correct dose of medication that I would be administering today. So the doctor did order a 1,000 units of heparin subcutaneously. It is supplied in 10,000 units per 10 mLs. So after calculating, we would draw up 1 ml, which will give us that 1,000 units for today. I then want to gather my supplies, introduce myself to my patient, close the door for patient privacy, perform hand hygiene. Hi, Mr. Smith. My name's Christina. I'll be your nurse today. Can you please verify your name and date of birth? I'd want to check Mr. Smith's wristband while he's verbally verifying his name and date of birth for double verification. Mr. Smith, do you have any allergies to food, medication, or environment? Perfect. Okay, so the reason I am here today is because the doctor ordered a heparin injection. This is just an anticoagulant that we use to treat or prevent blood clots. It interrupts our body's clotting mechanisms, which could prolong or even prevent blood clot formation. Some side effects would include possible injection site pain and easy bleeding or bruising. Some adverse effects would be dizziness, shortness of breath, and severe abdominal pain. If you do experience any of these adverse effects, please let me know immediately, Mr. Smith. I did also want to mention that you may feel a slight burning or stinging sensation at injection site, which is very common. Do you have any questions, Mr. Smith, before I begin? Okay, perfect. So I'd want to perform hand hygiene. I'd want to apply clean gloves. And then I want to make sure I have the right needle and syringe. So today I have a 3 ml syringe. And then for the sub-Q injection, I have a 25 gauge 1-inch needle. This is, normally I'd want to use a 5/8 inch needle for a sub-Q injection. It really just depends on your patient. We're going to attach that. And then we're going to want to take an alcohol prep pad and clean the top of the vial. I'm then going to want to pull down and withdraw 1 milliliters of air. And then I'm going to want to safely uncap and inject that 1 milliliters of air into the vial. Then I'm going to want to withdraw 1 milliliter of that heparin. Okay. Safely recap. I'm going to want to tap for any air bubbles that I may have. Okay. If I was preparing this elsewhere, I'd want to label this with the medication name and dose. We'd want to select our placement for our injection before injecting. So with a sub-Q, we'd either use the upper arm, the outer upper thigh, the abdomen, at least 2 inches away from the belly button, or the upper ventrogluteal area. And then here is my 1 mLs of the heparin. Okay. I'd want to inspect the skin surface for bruising or inflammation or any edema. And if there was, I'd want to select a different site. I would then want to palpate the site and avoid the area with any masses or any tenderness. And then I'd want to test the needle size with the skin to verify that the needle is 1/2 of the fold. So we just test that. Okay, perfect. Then I'd want to take an alcohol wipe and clean the injection site inside to outside about 5 centimeters. We want to let the site air dry and not blow in it or fan it dry with our hands going over that. And then I'd want to hold the syringe with my dominant hand between my thumb and my forefinger, kind of like I'm holding a dart. I'd want to safely uncap the needle. And then I'm going to want to pinch the skin to get that fold. And then with the sub-Q injection, we want to administer at 45 to 90 degree angle. Okay. Since it's a heparin injection, we would remain holding that pinch of the skin. However, with other sub-Q injections, we would release the pinch with our non-dominant hand, and then grab the bottom of the plunger to stabilize that injection while we were injecting, which I'll do that now. I'll demonstrate that. So we'd let go of that pinch, hold the bottom, and then inject slowly. We want to inject heparin medication over about 30 seconds. Perfect. We'd want to withdraw that, place gauze over it. We do not want to massage the area. I'd want to toss my needle and syringe into the sharps container. I'd apply a Band-Aid if needed. Again, I would not put the cap back on. I would just disperse both in the sharps container, remove the gauze, doesn't need a Band-Aid. I would remove my gloves, perform hand hygiene, and then I would go ahead and document my procedure.